Healthcare providers, health insurance companies, and other entities involved in the administration of healthcare may not share personally identifiable medical information without your consent. It is important to note that this rule does not restrict the ability of doctors, nurses, and other providers to share the information needed to treat you. Healthcare workers can hurt themselves accidentally with needles or sharp instruments that have been used in patient care. This is especially true in a dental environment. This carries a small risk that the healthcare worker can become infected with a viral disease such as hepatitis or HIV. Therefore, it is important to prevent blood contact to prevent infection. My clinic uses a double glove technique to protect staff from unnecessary exposure and patients from illness that can penetrate their already compromised immune system. A common cold could turn very serious to a patient with AIDS, and we take every precaution to keep our clients healthy. In recent studies, 2 pairs of gloves reduced the number of perforations in gloves by 71% compared to the use of 1 pair of gloves. Under the indemnification clause between AU Brightsmouth Dental and the plaintiff's DHMO, we are required to identify these patients and double glove when treating them. While using paper dental records, we utilize the red tape as a way to identify these patients in which we need to protect. To protect patient privacy, we only assess the records in preparation for the appointment on the day of the appointment. The records for that day's appointments are usually taken out of filing to review and for documentation. Staff document in the patient's record on the day of the appointment, and then the records are secured on the same day under lock and key in a non-patient area. After we were notified by the Office for Civil Rights that another patient may have seen another patient's records, we did a completely voluntary review of our safeguards based upon the information provided by the OCR. Although we were never contacted by the patient, we revised verification procedures, reporting protocol, and other procedures to verify that information is being used and disclosed appropriately. We voluntarily moved to electronic dental record, as well as train all staff within the facility. HIPAA does not include a private right of action. This means that an individual may not file a claim against a covered entity or a business associate in order to enforce HIPAA or seek damages in response to a HIPAA violation. For example, a patient is not able to sue a dentist if the dentist fails to distribute a notice of privacy practices or enter into a business associate agreement. The sole remedy of an aggrieved individual is to file a complaint with the United States Department of Health and Human Services Office for Civil Rights, which has already been done in this case and completed. Medical records may include your medical history, family medical history, information about your lifestyle, past procedures, laboratory test results, prescribed medications, genetic testing results, and related information. There is no private cause of action allowed to an individual to sue for a violation of the federal HIPAA or any of its regulations. This means you do not have a right to sue based on a violation of HIPAA by itself. We sincerely apologize for any discomfort that this may have caused, but we have taken all of the legally required actions to ensure that this does not happen again.